Hi guys, my name is Bernhard Baumgartner. I'm from Austria and I want to give you an idea about growth of COVID-19, of corona cases in Austria and why our government reacted the way it reacted and which effect this had on the growth of cases. So what is the problem? Why so many experts did not see the problem that was lying ahead of us? So we have a lot of information and fake information, at least in Austria, Germany, the German-speaking world, and people trying to convince us that there's no problem ahead. Because compared to the flu, the number of deaths is very low and will not increase. So now we know from Italy that is entirely wrong. So maybe you heard that up to 800 persons per day now die in Lombardia, in the city of Bergamo. So it's a quite high number and they do not know how to handle those people. What's the difference between the flu and corona? We are complete naive to corona, which means we have no immune defenses. And this is why it can spread, the virus can spread freely and infecting everybody because nobody has any defense from the past and there is no vaccination and nothing. The flu comes every year, so there's a new strain every year, but you know, when you go and have a flu shot every year and maybe sometimes you get infected, your immune system remembers and you get protection over the time. And this is the beautiful thing. And even so, one more point is that corona patients, they need intensive care. We will talk about it a little bit later. They need a breathing apparatus, and influenza infected people usually do not. So there's a big difference between those. But let's look at the numbers. Why so many experts were confused by the numbers. As we have no protection, so if we start with 2 people, they infect and after some time it doubles. This time might be after 6 days, might be after 5, 4, 3 days, depends on the dynamics, on the strain, how it develops. It started slow in China and is now much faster in Europe. So after some time we have 4 people, then after time 8, 16, a sharp increase, but the numbers are very low. Who would care about 32 infected people, not even one dead? 32, 64, rising more to 128, and going up 256. So this is already a little bit, and here even our little scheme is too small for the 512. Now we're 8 million people in Austria, and 512 people, that's nothing. Nobody would realize there might be a problem, and this is what people did not see. So let's change the scale. So I prepared that for you. And here you see, if we take bigger numbers, the initial rise doesn't look impressive at all. So from 2 to 512, there's a statistical deviation, there's nothing, it's just a little bit more or less people not having a problem because they're just infected, almost no severe illnesses we detect. So here, starting 512, going to 1024, now the rally starts. Now it gets really interesting. It doubles to 2048. And then after a time, after some days, it increases to 4096. Increase to 8192. Then, so you see now what's the problem ahead. 16,384, and then it goes up to 32,768 infected people. So here we have the days. Day 0, 3.5. This is the average doubling time we have in Austria. Every 3.5 days, the number of infected people doubles. So here we have 7 days, we have 10.5, we have 14, we have 17.5, 21, 24.5, 28, 31.5, 35, 38.5, 42, 45.5, and 49 days. So would you expect that within 7 weeks we would have more than 32,000 infected people starting from 2? Now that's an impressive number. You agree with me that within 7 weeks, which is 2 months, not even full 2 months, we start with 2 infected people and we end up with more than 32,000. This is exponential growth, and this is the danger we have in a moment, because around 80% of people, they do not even have real symptoms. So let's call them symptoms free, which is not completely true. They might have very light symptoms. Let's call them symptoms light. Because most of them will not even realize they have the coronavirus, or it's the SARS-CoV-2, as the virus is called. The disease is called COVID-19, and the virus is called SARS-CoV-2. And 80% of people will not even notice they have the infection. Around 14% have mild symptoms, but they already need assistance. They might go to emergency room and they need the respiratory aid. So here starts the problem, and around 6% they have heavy symptoms. So they really suffer, and we have to treat them. The number of dead people is quite different. It varies from 0.6 to 6% around people dying from the disease. That depends, for example, on the age of the population. In Italy, we have very old people, and they are at danger. People that are smoking, people older than 70 years, people taking medicine, for example, against hypertension, diabetic people. So there are risk groups, and we know that death rate is higher in those people compared to the young people. Especially young people have the infection, do not develop symptoms, but they are carriers. And this is the problem, the carriers. So now there are corona parties. Young people go out, drink beer, cheerful, nice weather, whatever, and they get infected. Absolutely no problem for them. On the opposite, for them it's good because they develop immunity. They do not need a vaccination later. They are already immune for at least some years. That's what we know from the SARS virus from 2002, 2003. So up to 5 years, we can detect antibodies against the virus in the blood of infected people. We have no idea how long for the SARS-CoV-2 virus this will last, but those will, according to those data, be protected for several years. But the elder ones, not. And as the number increases, those people need intense care. So they have to go to the hospital. So it depends very much on the number of free beds in intensive care stations. And with a certain number of infected people, all the beds are full, which means every infected person more is a problem. It's a person who cannot be treated, and this is what's feared so badly. Because maybe you already saw this graphics. So here again we have time, we have the number of infected people, and if we do nothing there's a sharp increase and then a sharp decrease in the number. So whatever, we do not know what happens exactly afterwards. But there's a number of people that can be treated, and it's a certain percentage of the total number of infected people that will determine how many people need intense care. And if there are more infected people, here is the problem. So you see that here there are too many people ill and sick at the same time who need intense care and who cannot receive treatment anymore. This is why many countries in the world now take very sharp and hard decisions and ask people to stay home or even force people to stay home. So what happened in some countries that took measures right on from the start, like Singapore, so they had an increase, but they flattened the curve and they stayed somewhere in this range, and so they were able to keep the number of infected people low enough so their system could treat all of them, and they end up with a lower number of dead people. So this is precisely why we need measures in the moment. That's the whole idea. So there are several other ideas like having waves. So let's paint it here. Okay, again here we have time and number of people. So the idea would be, if this is the highest number that can be sick at a time, you could have infection, cut it, it goes down, you loosen the regulations, numbers go up, and you follow this curve. So that's an idea that you can follow, but you have to take measures when it starts, as we already understood. Then people can do what they want from here on, and then again you have to take sharp measures when you see the number of people infected increases again, and here again. So you let people go out and keep them in again. So this is basically the idea behind that scheme. Maybe it works, maybe it doesn't work, because it's difficult to keep people home repeatedly, or it works better because people do not want to stay home for a longer time, like we would have with this idea. So in the moment we don't really know, we only know we ourselves can do something, and this is just cut the curve as early as possible. So we were 1 week ago at this number and we stayed home. Social distancing, have avoid as many personal and social contacts as possible. What will happen in the beginning? The number will keep increasing and then the curve flattens. Why is this? Something you might have thought about. Here we see 2 infected people at the beginning here, so there must be a number of people we do not know they are infected. This is a big problem. How do we know how many people are not infected? Because you remember, 80% of people do not develop symptoms. So we simply do not know. There was one village in Italy, Vo Eugenia, and they tested every single person, 3,800 something people. They were tested twice, so it was perfectly known who is infected, who no, and the guess is that around 50 to 70% of people are infected but have no symptoms. So we know that, and this number increases very much. So when we know we have a problem, there are already around many people with the infection. So we cut short and we expect this to go down, and then the curve of people we know that are infected also flattens a little bit later. So the moment the measures are taken, you will not they will not be reflected in the numbers for 1 week and maybe even for the second week. And then we expect to see the numbers. In Austria now, after 1 week, we see a decrease in new infections per day. We do not know if this is a statistical deviation or really flattening of the curve, but according to everything we know, this is already the starting of the flattening of the curve. We know that from countries like Singapore, from China, from other countries who took measures and were able to flatten the curve or keep it even low from the beginning. So for the moment, this is what I wanted to tell you, so to have a better understanding what is the problem and why you should not listen to people telling you there is no problem ahead. Don't worry, guys, just go on with your life, meet people, get infected, and infect old people, and they will die, no problem. So it's up to you to decide. But always remember, when you do that, you help the curve to increase very rapidly. So guys, stay healthy and hope to see you soon.